Hi, maybe this is not convenient that I can read a lecture, but this is the way that I can do it right now because I cannot conduct such a long speech without using Arabic terms and a lot of Arabic, but I don't like to use Arabic while I'm with you, so I'm trying to improve my skills in this situation, and I'm going to read it. And maybe we can have the discussion afterwards. What I was sharing a few moments ago, that I was really sad about the last lecture, not because the lecture, it was perfectly done, but about the topic, how human beings declined that way. Where are we going? That's very sad. I was just practicing what I learned from God years and years ago, that I have to feel what God feels while we are talking or speaking or doing anything. What is God hearing from us right now? Here's such a sad story about humankind. We are, as Dr. Nader said, his image and likeness, and this, the Bible says so. I was really sad. I was really sad to the point that I could not even breathe. But thanks God that we are gathered here to touch these topics. They are not topics. Actually, they are spiritual waves that are going to and fro to draw every one of us in that terrible tide. So we have to stand firmly, to be strongly founded in the Bible, in the church. And so we can not only face, but have an active role. Not in just doings, but in our prayers. I'm sure that our prayers can change this terrible situation. And I think, as God said to Abraham, when I find just 5 faithful believers in Sodom, I will not burn it. So we can be that 5 faithful to God. First, I like to start with that verse in Genesis 4, that God told Cain these words. What have you done? Listen, your brother's blood cries out to me from the ground. Now you are under a curse and driven from the ground, which opened its mouth to receive your brother's blood from your hand. What an awesome and fearful words we should consider nowadays concerning this important topic, abortion. When we hear also about those midwives who didn't obey the king's order to kill the Hebrews, newborn boys, because they feared God and how God was kind to them. This is in Exodus 1, verses 15 to 20. This is our turn now. First question, is he a human being? There is no doubt that the unborn is a human being from conception, and this is the result of the dynamic interaction between the male ovum and the female ovum and the male sperm, containing the 23 chromosomes to be 46 chromosomes. We all know that. And these are necessary in order to grow and to develop itself in the maturity in accordance with what God wants. Even abortion advocates, they typically do not dispute that the unborn is a human being during all or most of its time in the womb. For example, the philosopher David Bonin, in his book, A Defense for Abortion, he said so. So we come now to what is the definition of abortion? I know most of you know these issues. Abortion is defined as the premature exit of the products of conception, the fetus, the membranes and the placenta from the uterus before fetal viability, or in other definitions, before 28 weeks. But I was also shocked when I read about, I presented myself to you before this lecture, and I was shocked that here they can consider abortion up to 36 gestation age, 36 weeks. They consider that abortion. That's terrible. And I went through the procedure of what they call abortion. They call it partial birth abortion. They just dilate the cervix by some drugs and extract the leg of the baby and do what kind of a destructive operation for the brain of the baby, introduce something and suction. What is this? That is really terrible. I will go through it after a while. There are many types of abortion that threaten the missed, the inevitable, the habitual, the spontaneous, septic, and the induced abortion. We're going to talk about the induced abortion. We have some medical indications, and you will find this in the medical textbooks about abortion. Medical indications of induced abortion, the maternal and the fetal indications. The maternal indications, I will discuss the maternal first, and then we'll have just a point about the fetal indications, because I myself, I'm not convinced about that. But the maternal indications are the cardiovascular diseases, like the pulmonary hypertension, the Eisenmenger syndrome, the history of a myocardial infarction, the history of a pregnancy cardiomyopathy, and severe hypertensive disorders. Also the genetic diseases, like the Marfan syndrome, this is a connective tissue disorder. The hematologic diseases like the thrombotic thrombocytopenic purpura, the neurologic disease is the untreated cerebrovascular malformations such as aneurysm or arteriovenous malformations. The renal disease like any deterioration of the renal function in early pregnancy, and I had so many cases like that. The neoplastic disease, the invasive carcinoma of the cervix, and any neoplastic disease in which the maternal survival depends on prompt treatment with chemotherapy or radiation in teratogenic doses. And I will share about some cases like that at the end. The metabolic disease like the proliferative diabetic retinopathy, this is also a maternal indication for abortion. Terminal maternal disease like end-stage cancer and AIDS, and the disorders of the current pregnancy like the intrauterine infection. And we had one case. All these indications, the cases come to my mind that I really dealt with in such situations. Rupture of the fetal membranes before fetal viability and severe preeclampsia or eclampsia. This is also an indication. Pregnancies that may present a high risk of uterine injury, like the conjoined twins, like the placenta accreta, and it's easily diagnosed by the ultrasound. And any prior catastrophic uterine rupture, and we see a lot of these cases in Egypt. Neoplastic pregnancies like the trophoblastic disease, and usually the non-viable pregnancy like any fetal death in utero, and an embryonic pregnancy, as well as the inevitable abortion. These are the maternal indications for induced abortion. Okay.
What about, so when you said proliferative diabetic retinopathy, what complications occur
the policy says that any major illness that will affect the mother's health, even to the point that she will lose a vital organ, she will lose her eyes or lose the kidneys. So in this situation, and the pregnancy is just 8 weeks, and we know pregnancy is a real burden for the health of the mother. So at that point, we have to have a decision. If we go on in pregnancy, the condition will worsen. So we have to have this decision of abortion conjoined between the internal medicine and the gynecology. I usually take, and we usually do so, we take the consultation of the specialist of internal medicine before we proceed for abortion. And it should be a written consent. This was in my practice like that. The fetal indications, that is written in the books. It's a known major fetal malformations like the anencephaly, yeah, the meningomyelocele, and the severe hydrocephaly, and severe cardiac anomalies, and renal agenesis. And in these cases, we do induced abortion. Chromosomal abnormalities like the Down syndrome and other trisomies. This is written in the books, but I usually don't do that. And at the end of the topic, I will say to you some verses of the Bible that prohibits us from doing so in a baby with trisomies or some congenital anomalies. Fragile X and the X-linked recessive diseases like hemophilia. You know, if I find a baby with this kind of a disease, hemophilia, it's written in the books that I can do an abortion. Inherited metabolic diseases like the Duchenne muscular dystrophy and the Tay-Sachs syndrome, and fetal exposure to known teratogens like the warfarin, thalidomide, and the cancer chemotherapy. Radiation exposure, 15 rads or more as a total. This is a risk, this is a known risk. And radioactive iodine in ablative doses. And other maternal infections like the rubella, the cytomegalovirus, and the toxoplasmosis that led to major congenital anomalies. And here I have to say something. Sometimes the woman or her advisors overestimate the medical indications for abortion. The lay public and the many physicians currently believe that almost any drug taken in early pregnancy can be harmful to the fetus, and that any diagnostic radiology procedure is an indication for abortion. The physician's job in such circumstances is not easy. The usual rate of malformations is from 2 to 4% of all pregnancies. So the majority of these malformations are unexplained, and they have only minor effects. No one can guarantee in advance that any pregnancy will be normal. It may be helpful for the woman to present the risk of malformations after the exposure in comparison to her background risk of fetal malformations. You know, for example, the dose of 5 rads to the maternal pelvis in early pregnancy is considered to be the least dose that might represent a risk to the fetus. And IVP, the intravenous pyelogram, would be an exposure to 600, only 600 microrad, and this is well below the 5 rad exposure risk. Hence, the risk of fetal harm is low. The physician can assess the details of the specific exposure and then consult the literature to assess the risk of fetal malformations, and then we have to consult also a genetic counselor in this issue. When are abortions done? The usual or the most common timing in pregnancy is till 12 weeks. From 8 to 12 weeks, it accounts for 86.7%. 13 to 15 weeks, it's 5.9. 16 to 20, it's 4. More than 21 weeks, it's 1.4. And afterwards, it is 1.9. You know, the techniques, we'll just mention it. Surgical abortion, the first trimester abortion, is the suction and curettage, and D&C, or dilatation and curettage. Suction is much more preferable, and it's done like more than 90% of the cases within the first 12 weeks. And usually use a cannula that is the measurement of the cannula. It's like the weeks. If I'm in 10 weeks, I can use a cannula of 10 millimeters. And the second and third trimester abortions, and that was very shocking to me when I hear about that. It is practiced here. Second or third trimester. After 13 weeks, the more difficult because the fetus is larger and there is a greater blood supply to the uterus. The ways to do abortion in these situations, the D&E, dilatation and evacuation, we call it the demembraning, just to dilate the cervix and strip the membranes around the baby, and the D&X, dilatation and extraction, this I was describing a few minutes ago, and the intrauterine installation of saline. I can just introduce saline and then it will kill the baby, and afterwards, I know your heart is being broken right now. I know it quite well. I see your faces and expressions, but that's really sad. And the hysterotomy, it's like cesarean section, just an operation to evacuate the contents of the uterus. Chemical abortion, it's with drugs. Methotrexate is one of the drugs that is used extensively for that. We started using that in cases of ectopic tubal pregnancy, just to kill these cells of the baby and to avoid a catastrophe of internal hemorrhage for these cases. And they are used, methotrexate is used also in killing the baby if it is in the uterus, not in the tubes right now, till 7 to 8 weeks. We use methotrexate, or the other drug is mifepristone, it's RU486, it's quite well known. What are the side effects of these drugs? The possible side effects of methotrexate is nausea and heavy bleeding, vomiting, diarrhea, and headache, and I saw that before. At least 2 abortionists, I quoted the names of these abortionists. One of the maybe one of the most famous here. One of them is his name is Hakim Ilahi, and I was wondering, Hakim Ilahi. You know the meaning of this word, Hakim Ilahi. This is his name. And the other one, they stated that methotrexate is known to be deadly in some patients. And also mifepristone has some side effects up to death. And there were 11 cases of deaths reported in the past few years. Now we go to the reason for abortion. And this was also, you will be astonished to hear that. Most people, although many think that abortions are done mainly for the hard cases of rape, incest, or to save the mother's life, but statistics gathered by abortion providers themselves, they tell a different story. 75%, they say that this will interfere with pregnancy, will interfere with work, school, or other responsibilities. 75% say that they cannot afford to have a child, and nearly 50% they say that they do not want to be a single parent because they're having a hard time with their spouse. Now, we go to reasons for abortion. This is what we finished right now. Now the complications. The physical complications of abortion. You know, number 1, hemorrhage requiring transfusion, perforation of the uterus, cardiac arrest, endotoxic shock, infection resulting in hospitalization, convulsions, undiagnosed ectopic pregnancy, cervical lacerations, uterine rupture, and death. You know that this is not an easy procedure that we can go on easily just to have the decision of, let's go for an abortion, I'm pregnant, let's end this story. We cannot behave like that. And also, there is a study. It says so, in the Journal of the American Medical Association, found that having multiple abortions, this increases the woman's chance of having miscarriage in later pregnancy. It will affect her life forever afterwards. I got now, maybe I will touch a point of Dr. Mina's specialty, the psychiatric background of the problem after abortion. This I found this typically in so many cases who had abortion, what we call the post-abortion syndrome, the anxiety, avoidance behaviors, the psychological numbing, depression, re-experiencing events related to the abortion, preoccupation with becoming pregnant again, and anxiety over fertility and childbearing issues, interruption or disruption of the bonding with present and or future children, self-abuse, self-destructive behaviors, anniversary reactions, and brief psychotic disorders. And I read a lot about the emotional complications of abortion, and this, what I feel, this is a spiritual part, maybe more than a scientific one. It's not an emotional complication. It is actually a sense of deep guilt, as if I committed a sin before God. And because we are created in God's image, everything sinful in His eyes, they just reflect a deep sense of guilt or something heavy kida in my heart, as if I did something wrong, and that is really happening several times. A recent literature reviewed and concluded that abortion is a risk factor for mood disorders substantial enough to provoke an attempt of self-harm. And this is very important. And I read also something like that. A research published in the prestigious archives of general psychiatry acknowledges that many women experience post-traumatic stress disorder after an abortion. In one of the largest running studies conducted on women after abortion, researchers found that over time, relief and positive emotions relating to the abortion declined and negative emotions increased. And this syndrome includes dreams, flashbacks to the abortion, and general numbing or responsiveness not present before the abortion, and difficulty falling asleep. And this happens in nearly 31% of the cases. I now shift to the status of abortion law in the United States. Definitely, this was very new to me because I know quite well the law status of abortion in Egypt. It's legal for any woman, regardless of her age. It's legal for any reason through the first 6 months of pregnancy and for virtually any reason afterward. Now we move to, I think, the most important foundation that we have to step to. This is the biblical background to this. The Bible is far from silent from on the topic of the sanctity of a human life, especially in the womb. This resource provides just a few of the scriptures that speak about the value of the preborn life created in God's image from the moment of fertilization. I put that verses in several questions. First question, why should we value life? As Dr. Nader said, because we are created in His likeness and image. Know that the Lord Himself is God. It is He who made us and not ourselves. This is in Psalm 100, verse 3. Thus says the Lord, your Redeemer, and the one who formed you from the womb. I, the Lord, am the maker of everything. This is in Isaiah 44. But now God says, you are our Father, and we are the clay, and you our potter. And this is also in Isaiah 64, verse 8. Second question, who is the creator of the preborn? And Psalm 139 says so, for you formed my inward parts, you covered me in my mother's womb. I praise you, for I am fearfully and wonderfully made. Marvelous are your works. Another verse, and I was really touched with that. When God speaks to Jeremiah these wonderful words, Before I formed you in the womb, I knew you. Before you were born, I set you apart. I appointed you as a prophet to the nations. As if God is choosing someone to a mission. He knows him. And he is so happy that I created you. I appointed you. How can we just get rid of this? Because we don't feel like that we can continue pregnancy. What about God? Third question, is God concerned with the preborn? And in Galatians 1:15, the Apostle Paul says, but God chose me before I was born by his loving favor. And in Ephesians 1:3-4, praise the God and Father of our Lord Jesus Christ for the spiritual blessings that Christ has brought us from heaven. Before the world was created, God had Christ choose us to live with him and be his holy and innocent and loving people. Fourth question, are the preborn human beings? We touched that before. And I like that verse very much. When Elizabeth heard Mary's greetings, the baby leaped in her womb, and Elizabeth was filled with the Holy Spirit, saying, as soon as the sound of your greeting reached my ears, the baby in my womb leaped for joy. You know, the day of John the Baptist was yesterday or maybe the day before. I like him. Who is responsible for life and death? This is an important issue. Then God spoke all the words saying, you shall not murder. And this is in Exodus 20. I call heaven and earth to witness against you today that I have set before you life and death, and blessing and curse. So choose life in order that you may live, you and your descendants, in Deuteronomy 30. Another question, are humans permitted to take life before birth? This verse is very important. If men who are fighting hit a pregnant woman and she gives birth prematurely, but there is no serious injury, the offender must be fined whatever the woman's husband demands and the court allows. But if there is serious injury, you are to take life for life. So God says that this is life, and life has to be taken for life. Another question, how should a woman view her body and preborn life growing in her womb? You know, this is a lovely verse. Behold, children are a gift of the Lord. The fruit of the womb is a reward. And the final question is, maybe I skipped one question. I want to highlight this issue. Should a child conceived as a result of rape or incest be aborted? This is a strong question. Should? No. The Lord said to him, who gave man fathers should not be put to death for their sons, nor shall sons be put to death for their fathers. You know, rape, this is a sin. So I cannot kill the baby because someone had sinned, even if this someone is his mother or his father. How things are changed now. The last question, does God forgive those who have had abortions? Yes, yes. You know, the last verse says, in him who have redemption through his blood, the forgiveness of sins. God forgives. God forgives. But we have to consider the last issue in the biblical background. We have to distinguish between guilt and forgiveness. Guilt is my experience. Forgiveness is God's gift to me that I have to receive. Just after doing that operation, I noticed that very much. Some patients come to me and say, we want to have abortion. I say, no, I don't do that. You can go to anyone who can do that operation. And they can go, and they come back to me with this deep sense of guilt. When I discuss the forgiveness of God, they are burdened when I discuss the forgiveness of God in simple words. And when they receive it, they just feel calmed and they can restart again their fellowship with God. So we have to know very quite well, knowing who ultimately has paid the debt, allowing intimacy with God to be restored, and understanding the difference between punishment and consequences. And I have a story from the Bible. When David had committed that sin, his sin that is quite well known, and God told him, the son who will be born will die. And God waited, and this is in his wisdom, until this boy became like 7, 8 years old. And then he was going to die. And David was brokenhearted. And he prayed, God, can you forgive me this sin and let him live? And God said, no. This is a consequence. This is not a punishment, because God already forgave him, but the consequences are that. Finally, I would like to share some personal experiences from my practice. The first was 28 years old lady who was referred to me from an eminent cardiologist in Egypt. He was the dean of the National Cardiac Institute, and he is a relative to me. And this lady was having an advanced cardiomyopathy. She became pregnant and was asking if she can continue the pregnancy. And let me explain the story for you, because she had many social troubles. She was married to a man, and the family of that man was very strong and was against that lady. And after a while, they took their son from her and told her, if you are going to get a baby for us, then we'll let him be back to you. And she came weeping. And this cardiologist, I admire him a lot. He helped her a lot. And he told me the story. Are you willing to take care of her during pregnancy? Okay, I said, this is a real challenge. I will go in. And I tried to explain something about that to her. And I did many sessions of consultation with her. This may be dangerous and harmful to your life. Do you have faith that God will support you till the end? She did yes. She said yes to me. I will wait for God. Not only in medical way, but in spiritual way. Spiritual is much higher than the medical realm. So when I speak to the Spirit, then when the Spirit says yes, then God will work wonders. And now she's having a lovely girl. And she's back to her husband again. Another case, she was 40 years old lady who was referred to me from an eminent professor in Egypt. He was Dr. Mufid Saeed. Maybe some of you know him or hear about him. She was having an advanced breast cancer and was going to start the chemotherapy sessions. And she was pregnant 10 weeks. And after consultation with her, and we decided to terminate the pregnancy. But I say to you, something that I usually do when I do such an operation. I usually ask the patient to go to the church and to have the permission of the church. And I usually write the case fully to one of the bishops who is having a medical background, Bishop Amba Musa or Amba Rafael. And I usually did that. And they usually write to me الكنيسة موافقة بالحل والبركة. My spiritual leader taught me that. He told me that you have to take the permission of the Creator through his body, the church, before doing that, because he is the owner of that gift. And finally, the third was a friend of mine who was having two sons, 18 and 16 years old. She came to me, she was 43 years old, by the way. She came to my clinic shouting and crying, I'm in a catastrophe. I'm pregnant and I should get rid of it as soon as possible. I began the most tough and difficult counseling in my life. Through God's grace, she was able to accept and experience the wonderful gift what God was giving her. The baby, Fadi. Fadi is now like 5 years old. And she always tells him, call Uncle Ahdi. You know, we have a hymn quite well known in Egypt. Ya sabab wugudi. You know, you're the reason of my existence. Every time I see him, you are the sabab wugudi. Before closing, I would say that I would not have been here today. Not today only, but all of my life, because my parents, at a point, they decided to do an abortion while I was in the womb. They told me so. But God had another plan and gave them his word through a non-believer friend. And so I'm here today. Thank you. Any questions? Dr. Mina. Thank you. Yeah. 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 This is a very tough situation. I think tough questions cannot be answered by simple answers. This is a tough question because this is a question of life. But can we take it step by step? I know quite well that people need time. We have to sit with her and discuss all the issues about that pregnancy. Well, I want to express what I feel. I know there is a language barrier. I know, I feel it quite well right now. But you know, in my clinic, so many patients, they come to me seeking a child. We are married like 2, 3, 4, 5 years or maybe longer than that, and we don't have a kid. How come that after just one relationship with rape, a pregnancy occurred? Yes, this is physiology. This is not only physiology. This is God. Now we can go to him asking, why did you send this baby? You tell us in the Bible that babies are your gift. Why did you send a baby by this sinful relationship? Why? And there are so many husbands and wives living such a good and strong and Christian life, and they don't have kids. Why, God? Can we go to him asking that? This is beyond our realm, actually. This is not our question. We can just express what we feel to him, and he accepts. But we cannot judge him. Why do you do like that? God answers, this is my business. Maybe she is in a terrible situation after rape. Can we help her to restore her dignity, her self-confidence, and to see that child in a new vision, a new way, that this is God's gift. And maybe God can give us some gifts in bad circumstances. Yes. We've just listening to that wonderful lecture about the end of life. And God can give us some painful times, yes. And how are we blessed with that painful times? So this was at the time of rape. This was really a painful time for her. Can we counsel with her? Can we be compassionate to her in such a situation? Yes. And I think God can give her the power and the strength to accept. If we can do that role with her. Not just saying it's God's gift, so we have to accept. No. We have to be more and more compassionate and deal with the situation as if we are in the situation. And God himself is doing like that. He is in the situation with her. And he can help her a lot. And we should help, as a church, to accept. If she doesn't accept, I myself usually do that. I tell her, if you are insisting to do the decision of abortion, then go to one who is convinced to do that. But I don't do that. I understand your situation, but I cannot put my hand in such a situation. Go and God bless you. Okay.
So you mentioned one of my favorite verses, which was, "You're fearfully and wonderfully made." And I know that God has plans for everyone. But how do you reconcile the fact that he makes us like we are fearfully and wonderfully made, despite the fact that he knows that this person is going to die by an abortion?
I think this will drive us to think who is God and what he's doing. If we have a glimpse on that topic, God trusts us a lot. When he gives you something, he cannot take it back because you were not honest to that. He cannot take it back. When he gives something, he gives. And when he trusts you, he trusts you. He trusted man because he created man in his own image and likeness and gave him freedom and gave him authority. God, because man had fallen, why don't you take this authority off from him? God doesn't do that at all. Maybe God will accepts that in some situation to be blamed. And this is part of his humility. He is humble. And he teaches us to be humble. I think we have to accept that God can do that. Yes, for a plan. Yes, for what is in his head, in his plan for us. But in some situations, we destroy that gift. When I give you something as a gift, I gave you with all my heart. And you take that gift and you just destroy it. It's yours. I paid a lot for that gift. But you did what you want in that gift. This is part of the freedom that God gave us on earth. But we have to respect him. We have to fear him. And this is our message, I think, for our generation that is going down the hill fastly. Thank you.